Hello, everybody. My name is John Ingram with Town Square Media Montrose, and I am very happy to be joined with Dr. Samuel Holmes with Montrose Regional Health. He is an interventional pain management physician. Dr. Holmes, how are you doing today? And thanks for taking the time to chat with us.
I'm doing really well. Thanks for asking, and it's great to speak with you.
And I'm curious, Doctor, what brings you to Montrose? And tell us a little bit about your background.
Yeah, well, I just retired from the Army after 27 years, and my wife and I wanted to take advantage of being free agents for the first time in 27 years, and we wanted to stay west of the divide. So we looked at positions from Alaska all the way down here to Colorado, and Montrose Regional Health was just the best hospital location, hands down. And so we took the position, and we're really excited to be here. Part of it was I grew up in small town, Northwest Montana, and my wife grew up in rural Fargo, North Dakota. And, we were in these more populated areas with the Army, and we wanted to return to more of a rural setting to raise our three boys as well. And so we're really happy and feel very fortunate to be here.
That's great. I'm actually, a little bit about me, I'm actually new to Montrose as well, moved here about 6 months ago. It's a gorgeous area and really an up-and-coming area as well. So we're definitely glad to have you here, and I hope you like it as much as I do.
Thanks so much. Yeah, heck yeah, we're excited.
So tell us a little bit about your expertise. What type of patients do you see?
We see patients with chronic spine, neuromuscular, and musculoskeletal pain that hasn't responded to conservative or typical treatments and therapies. So when we're talking about those things, spine pain refers to neck and upper back pain or mid and low back pain, and it may involve pain that radiates from the neck or the low back into the extremities. That's often referred to as radicular pain. When we're talking about neuromuscular pain, we're talking about pain that involves nerve dysfunction and how that relates to the function of the muscles that they innervate or that they plug into. And then when we're talking about musculoskeletal pain, we're talking about pain that is associated with muscles, joints, ligaments, and tendons. And so those are the type of patients that we're seeing at Montrose, spine and pain.
And pain is part of everybody's life, right? Physical pain, it can really wear on you. And I know that there's a lot of different levels of pain and types of pain, specifically the difference between chronic and acute pain. Can you explain a little bit about those differences?
Oh, yeah, absolutely. It's a great question, and it's an important question. So just starting with the definition of pain. Pain by definition is a painful, noxious stimuli and an emotional cognitive response. Acute pain serves an actual vital protective function. That emotional response is what compels us to remove our hands from a hot stove surface or something that's injuring us to prevent further injury. It lets us know that there's tissue damage or impending tissue damage. Chronic pain, on the other hand, is pain that persists beyond that normal range of time it takes to recover from tissue damage. So often people think of chronic pain as pain that persists beyond 3 months. It's easy to just put a number to it. But unfortunately, chronic pain does not serve a useful function. And in fact, it inhibits function of quality of life. And the long-term effects on emotions and mood can be really challenging.
Yeah, 100%. And so, for example, just to kind of use your example again, acute pain would be if I burn my hand on a stove. And actually, you could argue that's a pretty useful type of pain, right? It kind of just lets us know that we're in a situation that is not good for us and is not healthy for our bodies. Whereas chronic pain would be something like persistent bad back, for example.
You nailed it. That's exactly right. Acute pain is that protective. It's an important, vital protective function. Chronic pain is for reasons that pain persists beyond that normal window, and now it's inhibiting function. And so that's where we get involved because we want to restore function and quality of life for our patients.
That makes a lot of sense. And tell us a little bit about your approach. I understand you use a multidisciplinary approach. Tell us a little bit about what that is.
Yeah, because chronic pain is pain that's been present for a long time. It takes time and teamwork to identify and treat the multiple sources and unwind the effects of chronic pain. And so multidisciplinary care refers to the team of healthcare professionals that work together with patients in that process. It's kind of an all-hands-on-deck situation with chronic pain. Multidisciplinary teams often involve referrals or recommendations to participate in these different specialties, such as behavioral health care to address the emotional components of pain, physical therapy, occupational therapy, chiropractic therapy, medical massage, acupuncture, yoga, whatever we can do to help. And there really is no limit to the size and scope of the multidisciplinary team. If the patient can benefit from something, we will explore that for their benefit. Literally all hands on deck to improve function and quality of life for our patients.
It sounds like there's not, of course, a one-size-fits-all approach to curing that chronic pain. It really is using the specific strategy or strategies that are necessary given an individual situation.
That's exactly right. Yep. We assess the patient and we work through that together, the patient and I as a team, and then add that multidisciplinary team, the components that may help them the most. Absolutely.
That's great. And let's talk a little bit about the strategies available. What are some of the different strategies to help patients with chronic pain? What are some things that they can do?
Well, at Montrose Regional Spine and Pain, our advanced practice providers and I, we direct that multidisciplinary team and provide additional treatment options such as medication and injection therapies. Oftentimes, medication and injection therapies can decrease pain and allow the patient to better benefit from those multidisciplinary treatments and therapies. And so when we're talking about injection therapies, those include maybe epidural steroid injections for the chronic neck and back pain that radiates into the extremities, or specific joint, ligament, tendon, nerve injections, wherever the problem is, we work to identify and treat it if there are issues with those structures.
If somebody is listening right now who wants to get in touch with you or, the whole department, how could they contact you guys?
The easiest way is talk to your primary care provider so that they understand that you're going through these issues as well, and then mention that, hey, I'd like to seek care at Montrose Regional Spine and Pain, and they can help out with the referral. We've got, a great website for the hospital, and within that there is a spine and pain center that you can access additional information to contact us. And then we've got a phone number that is 970-252-2584 that patients can contact for additional information.
That's great. Thank you very much. Again, that's 252-2584. And Doctor, while we have you, is there anything else that you want myself or the listeners to know?
I just want to know that, or any patients that have chronic pain to know that we're building a state-of-the-art team here to help you through that process. And we are excited to be here and work together to improve your function and quality of life.
Thank you very much. That is Dr. Samuel Holmes, Interventional Pain Management Physician at Montrose Regional Health. Doctor, thank you so much for taking the time, and we really appreciate it.
Thank you so much as well. Really appreciate it.
Thank you for listening to this Montrose Regional Health Update. Information provided in this podcast is for informational and educational purposes only and is not meant to diagnose any condition or provide treatment advice. Please work with your healthcare providers to determine appropriate treatments for you.